Awesome. Hi, everyone, and welcome to Decoding Horse Health, a webinar series presented to you by EquiSeq. I'm Madison Sanders. I'm your moderator for today's discussion. And by way of introduction, I'm on the board for EquiSeq, and I'm the CEO and founder of Elite Equine Marketplace, which is an interactive map-based hub that connects riders, trainers, and equine professionals with premium horses, quality equipment, barns, essential services, and career opportunities. So really making it easier than ever to buy, sell, and network with confidence. And as a lifelong hunter jumper rider myself, I've seen firsthand the importance of supporting horse health at every level, really from training and performance to nutrition and overall wellness. So today we're joined by two incredible experts, Paul Szauter, founder and chief scientific officer at EquiSeq, and Stephanie Carter, a functional nutritional therapy practitioner at Indigo Ancestral Health. So we'll give them a chance to share their expertise, and then we saved about 10 to 15 minutes at the end for audience Q&A, which we just tested. So y'all will be all muted during the discussion, but please drop any questions into the chat as they come, and then we'll address as many as we can at the very end. So before we dive in, I also want to be transparent about potential competing interests. As mentioned, I sit on the board for EquiSeq, and I receive equity compensation. And then Paul Szauter is also a board member, and he receives equity compensation for his work there too. Stephanie Carter does not receive compensation, and she is going to share some information about her book and her services at Indigo as well. So with that, let's give our guests a chance to introduce themselves. Paul, do you want to tell us a little bit about your background and what got you started with EquiSeq?
Sure. So I'm a recovering academic. I got my PhD in genetics in 1980, and I worked as a Drosophila geneticist, a fruit fly geneticist, in a series of academic jobs. And in 2000, I joined the Jackson Laboratory, which is a world center for mouse genetics. And I worked there in genomics and bioinformatics, and left in 2011 to move to New Mexico for a position at the University of New Mexico. And I worked there until 2014. And in 2015, I founded EquiSeq.
Yeah, awesome. So what made horse genetics an interesting opportunity for you, especially coming from flies?
Yeah. Well, the nice thing about being a biologist is that you can count on revolutions during your career, and I don't think that's going to change. And the big revolution during my career was a very ambitious project, the Human Genome Project, which was proposed in the 1990s. We would sequence the entire human genome. And part of that project was driving down the cost of DNA sequencing. When the Human Genome Draft sequence was completed in 2002, if you said, hey, I'm loaded, I want my genome sequenced, it would have cost $100 million. And in 2014, the price was $1,000. So that's 5 orders of magnitude in 12 years. And it's even cheaper now. It's probably $100 if you're willing to wait. So that opened up a lot of opportunities. Because sequencing became so cheap, we sequenced everything. It released a flood of data that's public that anyone can use for free. And at the same time, there's essentially no federal funding for horse because it looks bad to use your tax dollars to subsidize the sport of kings, right? So that's not done. And that became an interesting opportunity for a small company to make a real contribution to horse genetics.
Yeah, thank you, Paul. So Stephanie, tell us something about yourself and your work at Indigo.
Well, I have worked as a veterinary technician for 23 years, mostly in large animal practices in the Midwest and Southeast. Most recently, I was the case manager and on-staff nutritionist for an equine functional vet in Northern Virginia, where I'm based. My formal education as far as nutrition goes is actually in human functional nutrition. And I intentionally went that route rather than your traditional agricultural program because I found that those programs were operating on science that was a solid 20 to 30 years behind the information we have for humans. And through learning those principles and applying those concepts from the human functional nutrition to our horses and companion animals, I've been able to get better, more long-term results. And within the last couple months, I just published my first book, Managing Muscle Mayhem, which is essentially a horse owner's guide to all things related to equine muscle disorders and how to feed them. And that's available worldwide on Amazon.
Awesome. That's really interesting, Stephanie. And I myself look forward to ordering your book. So in your experience, what are some of the most common misconceptions that you see among horse owners when it comes to nutrition and muscle health?
I think the most confusing aspect is that most people think all muscle disorders require low sugar and starch diets. And while I believe minimizing sugars and starches is beneficial for all horses, some of the muscle disorders don't necessarily have the glycogen or sugar storage issues that others do. And knowing which don't can be critical in creating appropriate management protocols.
Right, right. Yeah, thank you, Stephanie. So let's turn to some of the topics that we've offered to horse owners. Paul, EquiSeq offers a DNA test to identify horses at risk for muscle disease. Can you tell us a bit more about this test?
Sure. So our test is like other tests for inherited conditions in horses. So we've identified a set of horse mutations that affect genes that are associated with muscle disease in human patients. So we use DNA testing technology is really very well established, and we use established protocols to detect these specific mutations. And we detect mutations in 6 different genes, and we report whether a horse has 2 normal copies, 2 mutant copies, or 1 normal and 1 mutant copy for each of the 6 genes.
And how does that benefit horse owners?
Well, so some people are trying to figure out what's wrong with their horse and whether they could make changes in diet and exercise that would help to manage the horse. And some horse buyers are using our DNA test as part of a pre-purchase exam because if they've had an affected horse, they generally don't want to have another one. And we're able to return results quickly enough to do that. Some breeders are using DNA tests to build a herd that will produce horses that's entirely free of all of these variants. And some veterinarians are using our tests as part of a diagnostic tree.
Yeah. So what sort of changes in diet and exercise are helpful?
I think Stephanie would be the best person to address that.
Okay, Stephanie, what sort of advice do you give to horse owners whose horses have symptoms of muscle disease?
I think it's hard to make generalized statements about the specific needs of all horses or these horses in particular due to my belief that they're all, bio individuals. But at a minimum, horses with muscle disorders tend to do very well with low carbohydrate intake, increased forage, protein, fat, and copious amounts of amino acids, while also minimizing as many of the processed ingredients, fillers, preservatives as possible.
Yeah, so it's important to minimize processed ingredients and fillers, it sounds like. So for horse owners who are new to this concept, what would you say are some of the biggest red flags on feed labels that they should potentially look out for?
As a rule of thumb, I have a list of my top 6 ingredients I recommend avoiding. And those are conventional soy, wheat, corn, molasses, canola, and zinc sulfate. All of those items are highly inflammatory, and they tend to have higher concentrations of things like glyphosate contamination.
Okay, awesome. Very interesting. Yeah, thank you for that. So in regards to symptoms, both of you, what sort of symptoms lead people to consider DNA testing? Paul, do you want to take that first?
Sure. So let me start by saying most of the symptoms we know about were from our research studies because we don't have laboratory horses, right? Talking to horse owners about symptoms and seeing photos, videos, and hearing stories. So the most conspicuous ones that we hear about are pain face. You just look at the horse and you can see that it's in pain. There are specific things to look for. Refusal to move forward. That's a key one. Changes in gait are a pretty reliable symptom. Two specific changes that we see are bunny hopping. So at canter, both hind legs are brought up at the same time instead of the hind legs coming up singly. And the other one we see is rope walking. So the feet of the horse go to the center line like it's walking a tightrope instead of walking on the outside. So those gait abnormalities are pretty characteristic. And then rapid muscle loss, especially in top line and hindquarters. Now, some of those things overlap non-genetic causes. So EPM or Lyme or other things like that are infectious diseases or parasites. And so it's really hard to put your finger on it, but those are the early signs that something is wrong.
Right. Stephanie, what about you? What are your thoughts?
I think in addition to the list Paul just gave us, typically I see these horses have persistent, like mysterious lamenesses. They tend to be described as either highly reactive or sensitive, and or those who have done every diagnostic without any answers, and something or things still aren't right. They're often the horses who are labeled as lazy, difficult, or sometimes even dangerous when their rider or trainer tries to push them through or train out their reluctance to move forward, jump, collect, etc.
Yeah, okay. So for owners listening who might be wondering if their horse's behavior could be related to an underlying muscle issue, are there any early or subtle warning signs that they should pay closer attention to before things get a bit more serious?
I think it's really important to pay attention when your horse says no. So that reluctance to go forward, or refusals, and or potentially difficulty using their bodies despite what would be considered appropriate training or conditioning. I think those seem to be the most widely ignored. But oftentimes I think it's the horse trying to tell us something else is going on, not just that they're difficult.
Right, right. So most horse owners watching this know about polysaccharide storage myopathy, or PSSM1. This is a disease that's fairly common in quarter horses, and the American Quarter Horse Association, AQHA, requires this DNA test and several others for stallions seeking registration. Paul, what is the disease identified by EquiSeq's DNA test?
Okay, so this is a deep question. Let's go back a few years to the original papers on PSSM in 2008 and 2009. So these are papers from Molly McHugh's dissertation research with Stephanie Valberg. So they were able to show an association between a particular abnormal result on muscle biopsy, so enlarged amylase-resistant glycogen granules, and a specific genetic variant of the gene encoding glycogen synthase, GYS1. So not all of the horses that were brought into their study for muscle biopsy because they had exercise intolerance showed that sign or that variant. And so they said, well, there's clearly something wrong with these horses. They thought there was an abnormal distribution of normal glycogen granules, and they called everything that didn't have the glycogen synthase variant PSSM2, and they figured that we would discover additional genes with defects causing a glycogen storage disease. So there's about a dozen genes associated with glycogen storage disease in humans. And in the over a decade since those mutations have been found, no mutation in any of those dozen human genes, the equivalent in horse, has been associated with a glycogen storage disease in horse. So I think it's an open question whether there is any such thing as PSSM2. Is there a carbohydrate storage disorder besides PSSM1? And I think the question is open. And so what really broke this for us was a paper from the Valberg group in 2016 studying Arabians that had been diagnosed with PSSM2 by muscle biopsy. And a closer examination of the defects using electron microscopy shows a breakdown in myofibrils. So the structure of the contractile apparatus in muscle, it's weak, it breaks down, it creates gaps in the muscle fiber, and those gaps tend to fill with glycogen granules. So that creates the false appearance of a glycogen storage disorder. So when we saw those micrographs, as the authors did, we connected that to a human disease called myofibrillar myopathy. So there's defects in over a dozen genes that cause MFM in human patients. And variants of three of those genes are in our panel. And we have a variant of a fourth gene that we believe will eventually be associated with MFM in human patients. And one of our other tests is associated with Col6-related myopathy in human patients. So the answer to the question is, what disease is this? It depends. Myofibrillar myopathy is kind of an umbrella term, and it resembles MFM in human patients, and one of the variants tests for Col6-related myopathy. So there's different disease states that they test for.
Okay, so that's PSSM1, PSSM2, and MFM. Are those the only heritable muscle diseases that affect horses?
No, I'd be remiss if I didn't plug Stephanie's book right now, because right there in the title tells you about three more: MYHM, HYPP, and RER. So just for the sake of completeness, immune-mediated myositis is an autoimmune disease with a genetic predisposition, and there's a single genetic variant associated with that yet now, but it doesn't account for all cases. HYPP is a single genetic variant. And RER is recurrent exertional rhabdomyolysis. That's complex, and it's associated with lots of mutations. There's a test for one of those things in our panel. So yeah, there are plenty of other disease states, and the problem for horse owners is chasing the disease names, and we would prefer to just follow the genes. And that's what we're doing now. But our collaborators at Generatio in Germany have proposed muscle integrity myopathy, or MIM, as an umbrella term. And that's not widely accepted because it doesn't follow human nomenclature. So I suspect that years from now, the horse nomenclature will follow the human nomenclature as closely as possible. But the human disease nomenclature is also in a state of evolution. So the one thing that isn't going to change is the names of the genes, right? So I'll say one more thing that's a big challenge for horse owners in understanding the association between genes and disease. It's not one-to-one. So in human genetics, there are many cases where a multitude of genes, so let's say 5 genes, cause a clinical syndrome that looks identical, and you can't tell which of those genes is associated with clinical syndrome. There are other cases in human genetics where a single gene can mutate in several different ways to cause multiple disease states. So you can go from many genes to one disease state, or from one gene to several disease states. And both of those ideas are relatively new to horse owners because all of the tests you know about are mostly monogenic disorders. So there's a single gene that has a strong effect, and it's associated with the disease state. So that's one of the challenges with our variants. You know, what gene is this? Do we have a PSSM3 and 4 and 5? And no, we do not, right? We're trying to follow human nomenclature as best as we can.
Yeah, very interesting. Stephanie, do you have anything to add here?
I think I'd just like to reinforce, kind of what Paul said about encouraging owners that because the terms are ever changing, and until the scientific community comes to a consensus on the language, owners should focus less on labels and more on the concepts. So glycogen storage issues versus muscle structure issues. And I personally believe that practitioners who are savvy in this kind of world will understand what you're trying to discuss regardless of the terminology that you're using.
Yeah, right. Given how confusing the terminology can be, what is your advice for horse owners that are trying to communicate effectively to their practitioners or trainers about these sort of muscle conditions?
I think it's really important to collaborate with practitioners who are well-versed in the realm of muscle disorders so they can help everyone understand what they're dealing with to avoid miscommunication, frustration, and so forth. And collaboration across specialties, in my opinion, is the only way forward, regardless of whether we're, dealing with a horse who has a muscle disorder, a chronic disease, or some other persistent issue.
Yeah. Paul, you talked about research in human patients and in other species besides horses. How do we know that research on other species applies to the horse?
Well, okay, let's start by acknowledging everybody's common sense, right? You can look at a human, a horse, and a mouse, and everyone can see that they're very different. You would never mistake one from the other. And, it's reasonable that people might question results from humans or mice applying to horses. But if you take a look at those species at a more fundamental level, they have a lot in common. So all the genes that encode proteins that are required for the function of a cell, so metabolism, DNA replication, protein synthesis, all that stuff, they're very similar among all mammals. And if you were to look at a micrograph of muscle tissue from a human, a horse, or a mouse, you wouldn't be able to tell which species it came from. So the muscle organization looks very similar at the ultrastructural level. And when you look at the proteins that are making up that muscle tissue, you can identify those genes across all mammals quite easily. So why is that? Well, that's because all living things share a single common ancestor. We're all descended from a single ancestor, and we use the same means of encoding genetic information. So eukaryotic life, with nuclei, mitochondria, chloroplasts, nitrosomes, all that stuff, that began about 2 billion years ago. So the first living eukaryotes were single-celled, and so all the basic functions of the cell, DNA synthesis, protein synthesis, metabolism, all that stuff, those genes are really old. They go back over 2 billion years ago, because when prokaryotic cells got together to form eukaryotes, those functions were already there. So those are ancient, and it's very easy to identify those functions in the genome of any living species. And then other things arose later. So about 600 million years ago, we get complex multicellular life with complicated body plans. Some of those things were animals, and they were clearly mobile, and they had muscle. So they were invertebrates, and they diverged from the mammalian lineage about 600 million years ago. And the proteins that you find in invertebrates, like fruit flies, in their muscle, are easily identified as similar to the proteins that you find in mammals. So muscle proteins go way, way back. There's been an elaboration since vertebrates arose, but the basic functions go back to multicellular animals. So that means that research on inherited muscle disease in humans and mice applies to horses. Now, there are some genes that are more rapidly evolving, genes involving, behavior or odorant detection in mice. Those are more rapidly evolving, and there's not a one-to-one match among all those three species. But muscle genes are not in that category. They're very old. And we can use everything that we've learned from human disease or studying human disease in mice and apply that to horse.
Yeah, very interesting. So one of the most common comments in the online horse forums, especially on Facebook, is that EquiSeq DNA test is not peer-reviewed.
Mm-hmm.
Can you tell us and elaborate on what that means?
Sure. So there seems to be a lot of misunderstanding about it, but peer review is really a restricted term, and it applies to a process of preparing a manuscript for publication in a scientific journal. So scientific journals are talked of as peer-reviewed, and that means researchers write a paper describing their research, and they submit it to that journal, and the journal has guidelines on how to write the paper and all that. And when it arrives, the editor assigns it to a couple of reviewers who remain anonymous, and they are well-versed in the field that's covered in the paper. And their job is to evaluate whether the paper is worthy of publication. So is the experimental design reasonable? Are the data clearly presented? Are they complete? Does it cite the relevant literature? Do the data support the conclusions? Is there enough there so another science group could reproduce that work or extend those findings? And If all of those things are more or less correct, they have a couple of options. They can say this paper is acceptable for publication with minor revisions that we don't have to look at. Or they can say there's something that really bothers us about this. Please fix this table or provide this citation, and we want to see what you've done. So they require additional review, or they can reject the paper. Sometimes a paper is rejected without going to reviewers. Like if we were to submit a paper to a physics journal, they're like, okay, this is a biology paper, this is a physics journal. So so a paper can also be rejected. And it doesn't mean when something gets into a peer-reviewed publication, it doesn't mean that it's correct. There are a lot of peer-reviewed publications that turn out to have errors or that have arrived at incorrect conclusions that are overturned by later work because they're using new techniques or more data or something like that. It's not an evaluation of the overall scientific program of that group. It just says, is this paper in a form that would let other scientists read it that's worthy of publication in our journal? And that's all that it means.
Yeah. So the lack of peer review means that EquiSeq's DNA test hasn't been evaluated by other scientists?
Not exactly. So we have collaborators all over the world, and they're listed on our website on the team page. And each of those folks, before they decided to work with us, we shared some proprietary scientific information, and we said, what does this look like to you? And in every case, the people that we've shared that information with have said, oh yeah, this looks serious. It looks like real work, and we'd be glad to collaborate with you. So that's one level of review. Much more serious than that, we've been granted patents in the United States and 23 other countries. We have 2 patents in for that have been granted. And that involves an extensive review process. So there are 2 things that patent examiners are looking for, novelty and utility. So we were able to establish novelty pretty easily because our patents were contested by the Valberg group immediately because they had a different working hypothesis. So that we have a different hypothesis about muscle disease in horses means that it's not obvious. So that's novelty. And utility means that ordinary people that can pull hair samples, as you have done, Maddie, and mail them in, can use the test to learn something about what's going on with their horse and possibly change management or change the breeding strategy to use for that horse. So utility was established by talking to a lot of horse owners. There was some unpublished data that we used and a lot of articles in German horse magazines where in Germany, our tests have been actually pretty widely adopted and actually recommended by the German Quarter Horse Association. So there are many horse owners in all over the world that are currently using the test and find them useful, and therefore it was pretty straightforward to demonstrate utility to the patent examiner. But that was also a full scientific review of everything, including the Valberg papers.
Yeah, speaking of the Valberg group and the EVA, so Valberg group and the British Equine Veterinary Association, the EVA, they've come out pretty strongly against EquiSeq's DNA test, citing the lack of peer review we just discussed. Are they wrong?
Well, they're not wrong. The question is, what happens when the papers come out? And the stuff we're currently working on right now is pretty technical. It's not going to be easily understood by most veterinarians. It's not going to be published in a veterinary journal, and it will not really be widely accessible by most equine veterinarians. So I'm not sure what the immediate response will be, but there will be, a cascade of explanatory articles and webinars and everything to help people get the idea. I think what the veterinary associations are interested in is they don't want veterinarians to change their practice based on, internet rumors. Let's use the worst possible pejorative term for us. And they say, okay, until we see articles in a peer-reviewed journal, we don't want people to change their practice. And that's not exactly the standard across all veterinary care, but I understand why they think that's important. And I hope that they'll take our work seriously and that we'll be able to overcome that barrier and that we'll be able to work closely with veterinarians in the future.
Right. So you said that patent examiners look for novelty and utility. And you mentioned this, you dove into it a bit, but Can you kind of put that into layman's terms? What does that mean?
Yeah, well, novelty means it's not obvious, right? So if you submit an invention that is obvious, right? Uh, I'm not sure quite what that would be at this point, but I mean, a minor improvement to something that currently exists, where everyone would say, "Well, that's kind of obvious," and I don't see that anyone has a different point of view on that. They will say it's not novel, right? Or they'll look at other patents in that field and say, look, this isn't really fundamentally different from what other people's ideas are. So your idea must be individual and probably even opposed by other people working in that area. And utility just means it's useful, right? So there are all kind of useful things that have been invented. And if something is interesting and novel but doesn't have any use, it's not patentable.
Great. Yeah. Stephanie,
Yeah, I think Stephanie will have something to say about utility, right?
Yeah, I was just going to say, Stephanie, how were EquiSeq DNA tests used for you in the veterinary practice that you were a part of?
In my previous position as a case manager, we only used the EquiSeq testing to diagnose muscle disorders in horses because we found it to be extremely reliable for making decisions about diet, performance management. The industry standard is, muscle biopsies, but they're extremely invasive. And in some cases, it's enough to trigger an episode, whether that means tying up or muscle fasciculations, what have you. And the biopsies also damage what may also or already be compromised muscle tissue, which then has an increasingly difficult time repairing itself or healing, which in some I suspect would create ongoing lameness issues or weaknesses that weren't necessarily there before. I actually still collaborate very closely with that practice, and that particular doctor sends me all of her clients with muscle disorders to create diets based on their EquiSeq results. So between those cases and the cases tested within my own practice, I've never had EquiSeq results mislead me in creating appropriate training and dietary recommendations to prevent or manage symptoms.
Yeah, that's amazing. Yeah, much less invasive than a muscle biopsy, just taking a hair test. So from your perspective, working directly with horses and clients, how has access to genetic testing like EquiSeq DNA tests changed the way that you approach the diagnostics, the diagnosing and managing of these complex cases?
The EquiSeq testing has made it far more accessible for owners to take their horse's health into their own hands. I think the biggest part is it's empowered owners to be more proactive and less dependent on their veterinarians who, due to the shortage of veterinarians as a whole, are already spread really thin, and or maybe they're not as well educated in the latest and greatest on muscle disorders. And as I previously mentioned, I've never had EquiSeq results fail me in regard to development of successful management protocols.
Yeah, that's fabulous. Paul, anything to add on your end?
Well, I want to pick up on a word that Stephanie just used, which is empowerment. And I think early on in our work, we got really sensitized to this because a lot of horse owners that we reached through Facebook, through the PSSM groups, they were desperate for answers. And one of the reasons that they're desperate is, of course, they went through all the diagnostic tests. They spent thousands of dollars and they didn't get a clear answer. But sometimes the answer that they get from their veterinarians, and I understand this because veterinarians are pressed for time, is that you're a lousy trainer. And, that would be a hard message to get as a horse owner who's already been going through all the diagnostic tests and trying adjusting diet, exercise, all that kind of stuff, and is still looking for answers. So what I would like to see is I would like to see all horse owners empowered. So, in current American biomedical research, the whole point is to make patients more responsible for their health. It's a partnership with your doctors. You can't just sit there eating potato chips in front of a television all day and then have the doctor give you a pill to make you better. So you and your doctor are partners. And I think horse owners ought to look at it that way. They and their veterinarian are partners. They're seeing more of their horse than their vet does. They understand their horse. They're talking to their horse. And part of the veterinary diagnostic procedure is assessing the horse owner. So being written off as a lousy trainer is not a proper response unless you obviously are one. But I don't think that's the case for most people bringing their horses in because of muscle disease.
Yeah, absolutely. Well, thank you both, Stephanie and Paul, for sharing such valuable insights today. There's been a lot of great information here, and I know many of our viewers will want to dive even deeper, especially through your book, Stephanie. It looks like we're doing really good on time. So I think we can go ahead and open things up for audience Q&A, unless Paul or Stephanie, you have any closing remarks.
I'd say go for it. Let's see what people have to say.
Awesome. So I will go ahead and take a look at some of the questions that have come in. So we'll just go down the line. Okay, first question from Audrey. Has PSSM2 been renamed to MIM?
Wow. Okay. It depends who you're talking to, right? So there is in human, there is a human nomenclature committee that handles human disease nomenclature. There is no such official body in horse. So different veterinarians and different equine researchers are going to be speaking different languages. And that's part of the challenge here. So for PSSM2, there may be such a thing, but I need to see a gene that's associated with a glycogen storage disease in human patients with a defect in horse before I really accept that there's a PSSM2. Right now, other people are going to say everything that isn't PSSM1 that isn't understood is PSSM2, and as for whether muscle integrity myopathy is going to end up being the name, I suspect not, based on the response. It's been out there for a couple of years, and people are unenthusiastic primarily because it doesn't follow human. So my guess would be, I think the correct answer to has PSSM2 been renamed to MIM is like, yes, in the minds of Generatio and in the minds of people that agree with them, but the majority of people working in this field do not yet accept that.
Yeah, okay, great. Well, next question. Can horses have multiple muscle disorders like PSSM2 and MFM?
Sure. So, I mean, the simplest thing to say is since we do understand PSSM1 and it's been out for, 15 years, that a horse can definitely inherit the glycogen synthase variant and have PSSM1. In addition to that, it could also have variants in the other genes, which are inherited independently. So it could also have mutations in filament C or myotilin or any of the other genes in our panel. And those turn out to be horses whose PSSM1 is not easily managed, and people can't explain what's wrong with them. So yes, it is possible for horses to have multiple muscle disorders. So they could have HYPP and PSSM1, or they could have RER and PSSM1, and they could have whatever we're calling our genes and any of those other things as well. And horses are highly inbred, so that does happen.
Yeah, absolutely. All right. Why does Germany have far more supplements for PSSM2? More people who tend to want to help horses/owners.
Okay, so that is in part due to the remarkable efforts of Melissa Cox, who is no longer with Generatio. She had done a lot of outreach and given a lot of talks at German universities. And so when they licensed our test, she already had relationships with a lot of academic researchers and veterinarians. And so their test volume was immediately larger than ours. And, and I think there was just a greater interest in that. And there's also a different population of horses. So in the United States, most horses, I think probably about half the horses in the United States are stock breeds, so quarter horses. Those tend to be rather inexpensive. And in Germany, there's more of an emphasis on, at least in this testing, was on warm bloods and horses that are going to be used in things like dressage or eventing. And so there's a much longer term bond between the horse and the owner that develops over that time. I mean, so in dressage, I don't know how long it takes to get to top level in dressage with a particular horse, but it's more than a couple of years, right? And so a dressage horse, maybe sells for what, 100K to 300K, not even going to the Olympic level, but that's a dressage horse. And you don't want that horse to fall apart when it's 10 years old, right? So part of it is what use are the horses being put to. So we've had pretty lousy luck with thoroughbreds because all people care about is how fast they run when they're 3, right? They don't care if they fall apart if they're 7, right? So it depends on the mixture of horses, and it also depends on how successful the outreach has been. And in Germany, that was Melissa Cox's effort.
Awesome. All right. Someone else mentioned that the PSSM Facebook groups, what are they? I would like to join. I think we could probably send a follow-up with some of those, but it's pretty simple. I'm a member of a lot of them too. And I just typed in PSSM1, PSSM2, and then groups, and a lot of them popped up. But Paul and Stephanie, if you have top recommendations on that, feel free to tackle that.
The top one is the PSSM forum on Facebook, which has over 30,000 members. So that's the one I always post regularly on because that's the biggest. And then there are groups in other languages. So you can find them in the Netherlands and Denmark and Finland, and you can translate the messages and work that way. But I'd say the really big one is the PSSM1 group forum in the United States. There are a couple other on managing PSSM or managing muscle disorders, and you can find those easily.
Awesome. All right, recommendations for feeding MFM horses that also seem prone to ulcers. Stephanie question.
That's kind of a tough question, simply because as far as I look at horses, it's really a case-by-case basis, and we have to take into account the horse's history, lifestyle, management, current diet, and potentially what the status of their microbiome is, because there can be populations of bacteria that are considered to be harmful and linked to the cause of ulcers. So for general recommendation, I would recommend a forage first diet. I am a big proponent of what I call a species appropriate, nutrient dense, real foods diet. So again, we're going back to eliminating a lot of the processed feeds, those top 6 ingredients we talked about at the beginning, and really focusing on starting with forage. But beyond that, it really takes you really have to take that bio-individuality of the horse into account to make a diet specifically for that horse.
Yep, that's where you set up an appointment with Stephanie and read the book. Mm-hmm. Yeah, awesome. Another feed-related question is there a resource that goes over feeding and husbandry needs per variant?
My book.
Yeah.
There's some general recommendations in there that are broken up by the particular variant. So I would recommend starting there. But usually to get the best diet for your specific horse, it's always best to work with a practitioner who's muscle disorder savvy.
Great. Stephanie, what is the best way to book an appointment with you? Kirsten looks like she wants to do this right after this meeting. So
that's great. I'd love to
your website Yep.
Yeah, I will give her a link to my website. Think I can type it in here, but it's Stephanie Carter, N as in Nancy, T as in Tom, P as in Paul.com. And right there on the homepage, you can book directly through the website there. You can also reach out if you have questions or concerns that you want to have addressed before you decide whether or not to book. And there's a lot of really good resources. I've done a lot of blog posts on the muscle disorders and things too. So if you head to the blog section or even the video lectures, I have some like basic tips there too. So
Fabulous. Awesome. All right. How long does it take to see changes? This is a great question, actually. How long does it take to see changes in horses after implementing their appropriate diet and management?
that's a good question. Again, I have to rely on that, bio-individuality question. It's going to depend on the horse. I see more often than not, I actually see horses start to improve within as little as 3 days. A lot of them, the sweet spot is about 30 days. I don't know whether that's necessarily enough time for the body to start to repair or, anti-inflame, but we are able to change the microbiome in horses within like 21 to 30 days time frame just based on what we're feeding. So I think that plays a little bit of a role in it too, because absorption improves, things like that. So there are also horses out there that I see struggle for 3 or 4 months before we start seeing improvement. So again, it's really kind of a horse by horse basis, but you can see changes in as little as 3 days.
Wow, amazing. Okay, my horse's EquiSeq test results are positive for P3 affected heterozygote and positive for P5 affected heterozygote. And P3 and P4, does this mean that there's a 50% chance of the P3 and or P4 expressing itself?
No. I mean, so what the 50% number for heterozygotes is the chance that if you bred an NP3 to a horse that was clear for P3, you'd have a 50-50 chance of getting a horse that had one copy of P3 and a 50-50 chance of getting a horse that was clear. So that's where the 50% chance comes from. Now, as by expression, you mean does the phenotype manifest itself? In genetics, expression simply means the gene is on and it's making a protein, and these are on appropriately and are appropriately regulated all the time. The question is, what causes the disease phenotype? So P3 is a mutation in filament C that's very well understood in human patients. It's semi-dominant, meaning if you have one affected copy of the gene, you get protein misfolding, and it starts a cascade of events that leads to muscle disease. The same thing is probably true for P4. That's myosin 3. That's required for muscle development and function in zebrafish, as we've shown. And so the 50% number, again, is from transmission. The chance that you're going to get symptoms in this horse depend on a couple of things. The one thing is environmental insults. So the insults have already been alluded to in this talk. One is surgery. So anything that puts a horse into negative nitrogen balance, so it's tearing down muscle to rebuild or to fight infection. So illness, injury, or surgery will cause a muscle loss in order to supply protein to fight those things, right? So we do know of a horse, for example, that had a sudden episode without any prior episodes or any prior symptoms. And it turns out it was a P4 heterozygote. And what happened was a hoof abscess. So it had a hoof abscess that caused negative nitrogen balance, and it lost the ability to stand because it lost enough muscle mass in fighting that infection to do that. So if your horse is not infected ever, if it doesn't have injuries or surgery ever, the onset of symptoms could be really delayed. And so it's not possible to say what the chances are that that horse will show symptoms. Another thing that matters is the background genotype. So there's 20,000 genes in a horse, And horses that nominally have the same genotype with respect to a couple of genes that we test for can be very different because of their background genotype. And one of the things we're going to be looking at in the future is genes that we think make it harder to carry these variants. So there are genes that are part of what's called the protein quality system that get rid of misfolded proteins. That's probably a little more science than you want, but that is the basic answer to the question.
Awesome. Thank you. Okay, outside of diet, do you find any specific therapies to be useful for muscle disorder horses? Body work, chiro, magnetic blankets, red light, acupuncture, etc.
You want me to take that one? Okay. So I beyond the diet, which I think is the sort of keystone to being able to manage these horses, I think it's essential for them to get body work, particularly a modality called osteopathy. And if you're unfamiliar with osteopathy versus chiro or some of the other body work modalities, you can check out the Vlugen Institute. They have some good videos on explaining what it is. But osteopathy, I find, is extremely beneficial. I think you have to be careful with some of the other options as far as magnetic blankets, PEMF, Beamer, things like that. In my practice and my experience with the horses, there's been a lot of them with certain variants that seem to be sensitive to anything electrical. So whether that's PEMF or Beamer or even EMF exposure, which I know is a little woo-woo out there for some people, but I have known horses who have been competitive, who travel to different showgrounds that happen to be under power lines or near transformers, or they have, Wi-Fi in all the barns, things that they wouldn't normally be exposed to at home. And they are just absolutely explosive. They're totally different horses, far beyond just your up sort of show nerves type situation. So I think that depending on the variant, they can be sensitive to things like that. So you have to be careful and kind of read your horse. I think red light therapy, I think, can be really helpful. I have started using that a lot more, recommending that a lot more with muscle disorder horses who have active muscle damage, we'll call it, or stiffness, tightness, things like that. And it really seems to be helping them manage a lot of those symptoms. Acupuncture, again, can be fantastic, but it is helping open up those meridians and changing potentially the way the electrical impulses happen in the body. So I think some horses, depending on the variant, can react poorly to that. So again, it's one of those you can try, but you kind of have to read your horse sort of situations, especially if you're talking about like electroacupuncture.
Awesome. Thank you for that. How prevalent are muscle disorders? I'm noticing it now, but has the support only been developing more recently? And have we just dismissed these types of horses in the past?
Well, let me start to take that one. And what I'll say is that horse ownership has changed in the last century. So 100 years ago, if a horse couldn't do the work that it was bought for, it would be made into chili or sold to an idiot, right? You weren't going to keep a horse like that around. And now we're in the era of the forever horse. People take on a horse, maybe an off-track thoroughbred, something like that, a rescue, a Mustang, and they say, I'm going to take care of this horse for the rest of its life, regardless of whether it does anything useful for me. Yeah, I'd like to ride it. Maybe I'd like to compete in it. I'd like to do this or that with it. But if the horse can't do it, I'm not going to get rid of it. I'm going to keep it, right? And so there's a change in the style of horse ownership. And, so 100 years ago, yeah, plenty of horses fell apart at 7 years or 10 years old. And people say, well, that was the life of that horse and they're done with it. And now because we have the forever horse, people care more. Also, the science has leapt forward. I mean, medical science of 100 years ago, I mean, I think we're still balancing the four humors practically, and it's a completely different world now. So what we see depends on how we're looking and what we're looking for. And if somebody says, well, that's just horses, it's always been that way, then we'll continue the way we did 100 years ago. But if we say, look at these tools that we have now and look at how horse ownership has changed and what is it that you want out of a horse? And I think that's what's changing looking at muscle disorders. Stephanie, you got something on that?
I agree wholeheartedly with everything you said. I also think that along that same vein, horse owners are changing their approach to training methods as well as, you know, husbandry skills. We're learning that maybe what we were doing 50 years ago isn't as good as we thought it was, and I think we're moving toward a more compassionate, connection based relationship with horses, where owners really are intuitively connected, and they understand their horses on a deeper level because they're paying closer attention than maybe folks were previously. And so I think that shift has also caused us all to really look more closely at other possibilities. You know, when the diagnostics come up with no answer, where do we go next? What options do we have to consider? And I think that alone is causing us to find more of these horses. I think the thoroughbred sport horse industry as a whole is a huge reason. You know, with the RRP, the Retired Racehorse Project, starting, I think it was probably within the last 10 or 15 years, that they have started having the big RRP competition and taking horses off the track and retraining them and all of that. It's really breathes a lot of life back into the American thoroughbred as a sport horse. And I think we're finding, as they're changing careers and they're aging, that a lot of those foundational bloodlines are carriers, and they were bred to race. And a lot of the characteristics of a good racehorse actually equate to the symptoms of the genetic variants that we're finding now. Particularly, I find a ton of thoroughbreds have PX, and it makes sense because, you know, they're being bred kind of to leap out of their skin and have explosive starts. So that's desirable for the racing industry, but not necessarily the sport horse industry.
Yeah, so let me follow on with that. I mean, it's not just the PX. I mean, that does make a lot of sense. When that gate opens, they're supposed to flow right out of it, right? And just boom. The other thing, we have unpublished results from our collaborators who've been evaluating dressage horses. And so they're using Generatio's chip, the Illumina Dietary, to genotype with respect to 80,000 variants, including ours. And they're judging horses for dressage performance at 4 or 5 years old. And it looks like P2 and P4 are under positive selection, meaning those horses score higher at 5 years old for dressage. And I think what they're picking up on is hypermobility. And my favorite study in ballet dancers, which I've probably told you about, is a study of like 50 professional ballet dancers. They sequence the exome and they look for connective tissue disorders. And 100% of people doing ballet at the professional level are mutants, and they have variants in connective tissue. So they have hypermobility. The way they extend their arms so beautifully in ballet is because their connective tissue is not as solid as yours. And so I suspect that's what's going on. So that's one of the reasons that some of the variants are at high incidence. We've been inadvertently selecting for them by rewarding hypermobility.
Yeah, thank you, Paul. I think we have time for about one more question. So any tips for surviving farrier visits? My P3 horse really struggles with his hind legs, and it seems to be really painful for him. I have a horse that does the same exact thing. So unfortunately, we have to give her some things to make her feel more comfortable for that, make her sleepy. But Stephanie can take that on a more professional approach.
I know a lot of folks will do things like they'll get prescriptions from their vet for things like methocarbamol and Robaxin, which are essentially equine muscle relaxers. That is quick, and usually you can use it short term just to make them comfortable or ahead of farrier appointments. On a more long term basis, if they're still having trouble picking up their feet for the farrier, I'd really be looking more closely at the diet as a whole. But they probably, P3, you're probably looking at needing more magnesium, potentially maybe some nerve support. But again, I think it really takes looking at the diet as a whole and how that might be contributing to the symptoms you're seeing, especially with the farrier.
Awesome. All right, we've got one more question. We'll just try to squeeze this in if we can. Do you find that muscle disorder horses can be ridden with proper management? Has there been success in returning them to a ridden life?
I do know of some cases where people tell us that, but I mean, so this one person is doing events with a horse that's a P3 heterozygote, and she has an extremely tight management and exercise protocol that she keeps the horse on. She says about 2/3 of the time it's able to perform at the event, and about 1/3 of the time it isn't. So all the travel and all that stuff is wasted, but the 2/3 of the time that the horse can deliver, she really likes this horse and she says it's worth the trouble. So it can be ridden sometimes with proper management, maybe even most of the time. And when it goes south, let's just say from like something that's been playing from the top of this, listen to your horse. Don't push your horse to do something it's telling you it doesn't want to do. And
Right.
between that and the tips on management, I think yes, the horse can return to ridden life, but there are going to be some bad days, and you have to watch out for those, and you have to know what the signs are.
Yeah, absolutely. Stephanie, anything last minute to add to that?
I think that pretty much covers it. I have quite a few horses that are performance horses that came to me unable to do their job, but it sometimes takes us a year or two because there's a lot of layers beyond just the muscle things typically that need to be worked through, but they do eventually get back to doing a job, maybe not necessarily high performance like they were meant to, but they can go back to a job.
Awesome. That is hopeful news. All right. Well, we're just 2 minutes past the hour. So thank you all so much for joining Decoding Horse Health. We will send a follow-up with our contact information. We really appreciate your time here. This has been a great session. So until next time, thank you all so much and happy Veterans Day.
Thank you.
Thanks.
We'll see you next webinar, whenever that is.
Yeah.
All right. Thanks, everyone.